Hello and thanks for joining us from our studios in Israel. I'm Natasha Kirchak here with ILTV's morning briefing.
620 new cases of the coronavirus have been diagnosed over the last 24 hours, meaning 6,211 Israelis will now have been diagnosed with the coronavirus. 107 are now in serious condition, with 127 moderately ill. The vast majority, luckily, have light symptoms, and 289 have now recovered from the disease. The death toll in Israel from COVID-19 continues to rise, however. 31 people have now passed away from the deadly virus. The latest deaths include a 72-year-old man in Tel Aviv and an 87-year-old man in Beersheba, both with pre-existing conditions. At the same time, Israeli Health Minister Yaakov Litzman and his wife have now both tested positive for the coronavirus. The 71-year-old health minister is the most senior Israeli official to be diagnosed with COVID-19, and he and his wife are now being treated in isolation according to his own ministry's guidelines. All those who have been in contact with them are now being sent to quarantine as well. Litzman's diagnosis comes after his prominent role in handling the coronavirus crisis, ordering tens of thousands into quarantine and pushing for self-distancing. But the ultra-Orthodox leader of the United Torah Judaism Party has been criticized by health professionals for his handling of the outbreak. Many claim he has put the interests of the ultra-Orthodox community ahead of the needs of the general public. And senior medical officials have urgently asked the Prime Minister to appoint a professional figure as health minister instead, saying that health comes before politics. Because the health minister is now infected with the coronavirus, the Israeli Prime Minister himself is officially going back into self-quarantine this morning. Netanyahu had just been released last night after previously coming into contact with a sick aide, and he was able to announce new regulations across the state of Israel amidst the coronavirus outbreak. In a bid to stem the spread of the coronavirus, Israelis are now required to wear masks in public, and those who do not have a mask can either use a scarf to wrap their face or can improvise. The most important thing, according to the Health Ministry Director General, is that the nose and the mouth are covered. Israeli Prime Minister Netanyahu has also announced that families will be receiving a one-off payment of 500 shekels per child up to the fourth child. That's about $140. The same exact stipend will also be given to the elderly, although the minimum age has not yet been specified. These payments are supposedly going to be approved via emergency legislation and will be made directly into bank accounts right before Passover, without any bureaucratic red tape. Netanyahu has also announced efforts to slow down the rate of infection in Bnei Brak, a city just outside of Tel Aviv that's home to a large ultra-Orthodox community, which has been failing to adhere to regulations. Now, transportation will be limited in and out of the city, and all sick people in Bnei Brak will be evacuated to special medical hotels in an attempt to stop families from infecting one another. In addition, anyone arriving into Israel from abroad is now required to quarantine in one of Israel's special coronavirus hotels for at least 14 days. And last but not least, Israelis are required to only celebrate the upcoming Passover holiday with their immediate families or those that they are currently living with, out of concern that many will break social distancing rules on the night of the traditional Seder. It looks like a vaccine in Israel could be closer to making its way to the public than ever before. The Israel Institute for Biological Research has begun testing a COVID-19 vaccine prototype on rodents at its biochemical defense laboratory. Israeli Prime Minister Netanyahu says the director of the IIBR has informed him of significant progress in designing a vaccine prototype. IIBR's chief innovation officer has given rare comments to the public, though, saying that using animals for testing is a very big challenge because the disease doesn't affect them. While the Israel Institute for Biological Research has also been collecting plasma from people who have been diagnosed with the coronavirus and recovered, all in hopes that doing so may help their research. Right now, there are other promising research projects on vaccines by Israeli scientists at labs in Israel's north, including the Technion Institute of Technology and the Migal Galili Research Institute.
That's all for now. I'm Natasha Kirchak, and see you later with our main daily broadcast.